Okay, everybody. Hello, everybody. Let me go ahead and call this meeting, and I want to thank everybody for getting here, but we're so promptly on my committee, but we're going to have another meeting tomorrow. Apparently, there was some miscommunication with Legislative Council, and they misunderstood what we wanted to happen with Senate Bill 109. That was joining two bills together, and instead they stripped one, and we ended up with just one bill. So we will be meeting tomorrow, and looks like that'll be no, quit laughing, Doug. I am not the one for once that talked to Legislative Council. It could be me, but this time it's not me. Okay, so anyway, we have one bill for today, and that would be Senate Bill 106, and Senator Walker is ill, and so Senator Kay Kirkpatrick has been nice enough to say she would present his bill, so that's Senate Bill 106. Do I have it?
Thank you, Madam Chair, committee members. Hopefully you would go easy on me since I just saw this bill this morning. But let me see if I can explain. I don't think I have to set the stage with anybody on this committee for where we are in the state with maternal and infant issues that we have. So we're working hard to try to address that, and this bill should be a big step in that direction. The LC number that I'm working with is 339512S. Is that what you guys have? Thank you. This bill is pretty straightforward. It has actually three sections, but the first section just names it the Healthy Babies Act. The second section is under the Department of Public Health, and they're going to do, under this bill, a pilot program for home visits for at-risk and underserved communities during pregnancy and early childhood. And the bill, and my understanding, this is sort of underway already, but this requires a detailed written report to be done. The next section, section 3, is a different project, and that one is under the Department of Community Health, and my understanding is that's going to be administered through the CMOs. And this is a remote maternal health monitoring plan, and the intent of this would be to collect medical information on high-risk patients with a remote fetal monitoring device, which is like a non-stress test, and this would take place at the home. And then this data would be collected, and the department would submit a report on the results. So this is all an effort to improve our situation. We do have some remote monitoring that is going on now by physicians in the metro area who are doing this by telehealth, and the person is going to a clinic, and then they're communicating. The ultrasound is transmitted real time to the provider. But this is a little bit different. This is something that's taking place in the home and providing information about the fetus. Be happy to try to answer any questions, but we do also have representatives from DPH and DCH here in case the questions get too difficult.
I guess, Senator, the closest thing would be to it that we have now is when sometimes there is, when a cardiologist is wanting to look at the heart and see what's going on, they have you wear something strapped onto you that monitors the heart and sends to a company exactly what's happening 24 hours a day so they can, really get a good picture of your heart. This would be something, I think, don't they strap it around their abdominal area or
Correct.
their waist and like that? So it would be the closest thing they have. Representative Reese.
Yes, thank you, Madam Chairwoman. Thank you so much for filling in on this bill, and you've done a great job. I really like this bill. I'm in Columbus, and my wife is a doctor. They've heard that many times before. But the disparities that we have in rural Georgia, especially Southwest Georgia, as it relates to access to healthcare. And what I like about this bill is that the pilot will work specifically in some of the rural areas to see. I like it when we attack the most challenging parts of our healthcare system versus doing pilots in areas where we know we're already served. So this is getting right to the root of the matter. I think this is a great study. I can't wait to see the results of it. I do believe those results will be promising. I think I can say right now that I think this will be a great implementation for parts of Georgia. And talking about the telehealth portion of it, you know, there are some doctors that are still not quite comfortable with that yet because their learning of medicine taught them to evaluate patients, to look at them, to be able to touch them and feel them. And we hadn't quite figured out how to do that through a computer system yet. So telehealth is helpful in some places, but in other areas it quite don't go further enough. So that's why I like this actually makes a visit. And Madam Chair, at the appropriate time, I would like to move for a due pass.
Representative Seaball, you were next.
Thank you, Mr. Chairman. Senator Kirkpatrick, always great to see you. Thank you for filling in on this. I'm a big fan of telehealth, and my understanding on this bill is public health will send nurses out to the home to do these tests, because it's not, I don't
Actually,
see it in here.
Representative Seabaugh, the home visit part of the bill goes through public health. The remote maternal fetal monitoring takes place through the Department of Community Health. So
Okay.
two different
But
departments.
will it
But
be,
I'm hoping they're going to work together closely, and they're sitting over there nodding their heads
okay,
so
but
that
it'll be
we
a
can figure out
nurse?
how to combine some, yes.
It'll be a nurse, okay.
Yes. And I would just like to respond to Representative Reese's comment. Telehealth was not something that was very common prior to COVID. It was beginning to happen, but I think out of necessity, a lot of people who wouldn't even normally do telehealth, like me as an orthopedic surgeon, learned how to do it and kind of figured it out. And so I think it's actually become a very valuable part of our healthcare portfolio. Not everything's amenable to telehealth, but I think we'll find as time goes on that more and more things will be. So thank you for your comments.
Okay, Representative Hutchinson.
Thank you, Madam Chair. I'm also a fan of telehealth, Representative Reese. It's tremendously valuable in mental health. But my question is, and I love this idea, who's going to get the devices in the pilot program? Like, is there a demographic that they're shooting for, or every baby? High-risk pregnancies, okay.
High-risk pregnancies.
All
I'm
of
sorry,
them?
Senator, I just thought.
High risk, but it's, my understanding, I could be wrong, it's that this is not a continuous monitoring. This is a snapshot.
Okay,
So this is associated with someone visiting the home.
okay, so not every high-risk pregnancy in a certain area, or?
It's, let's see, I'll look at the bill and see what it says.
Senator, I'm not sure that, I think that it can be done when somebody visits, or I think it can also be done if the device is left with somebody in the, let's see.
Randy?
Hi, good afternoon. Brandy Sylvan with the Department of Community Health. So these devices would be for high-risk pregnancies. They would be physician-ordered. And it is a device that the patient would maintain at home, and there would be a certain frequency that they would, conduct this test themselves, and that would be reported back to a monitoring entity that can communicate with their provider to let them know if they need some additional visits or additional health care needs.
So for the pilot program, is it like every high-risk pregnancy in a certain zip code, or?
So
How
I
do they
think
pick
that can
them?
be defined as part of the pilot. I know
Okay.
the original intent was to look at rural counties where access is an issue.
Okay. All right, Representative Al? Howard? Oh, wait, you waved? Okay, Representative Howard.
Yes, thank you, Madam Chairman. Thank you for the bill. It's very interesting, and I think it's going to be effective. I represent a rural population, not as a representative, but as a pastor. And I noticed it's going to be electronically transmitted. Would that have anything to do with broadband? How would that be transmitted?
There would have to be broadband for the information to be transmitted.
And that's a major problem in the area that I pastor, and I know a lot of other areas in Georgia. So how do we address that issue?
I think a lot of people are working to address that right now and have been for several years. And so that probably would be a limitation in who would have access to the
Right.
program.
Okay. Is that it? Okay, no other questions? Anybody from the audience that wants to speak to the bill? Okay, don't we have anybody that looks like they want to speak to the bill? Representative Reese, you're recognized for Representative Reese, you're recognized for a
Yes, thank you, Madam Chair. And let me just say for the record, I do like telehealth. I don't want that to be the headline tomorrow of the AJC. But as far as Senate Bill 106 LC 339512S, I recommend it do pass by this committee.
I have a do pass and a second. Any further discussion from the committee? Hearing none, everyone in the favor of the passage of the substitute to Senate Bill 106, say aye. Aye. Anyone opposed, no. Okay, the ayes have it, and would you please be as careful coming tomorrow as you did today? And I want to thank you very much again to the committee for making a point to get us a quorum. Thank you. What? I'm not sure. Who is the House sponsor? Okay?
That's a great question. I'll find out and let you know.
Okay, if we need to, I'll do it. Just like today, you're doing one for me, whatever.
No, I think this was
Okay,
here from the last. It's been left on the table.
okay. Thank you, we're adjourned.